from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and we're joined by Dr. Erica Stokes, and she's joining us from Baptist Health. And Dr. Stokes, thanks for taking some time out of your day to join us and talk about the Delta variant. This is something that is going through Arkansas right now, causing a massive increase, and not just overall cases, but hospitalizations as well. Can you go ahead and explain to our audience what makes this variant so different from one of the original strains that we saw of COVID as it made its way through the state last fall and into the winter?
Sure. So this virus is much more transmissible, which means it's easier for people to catch it from other folks, about 50% more transmissible. So whereas that original wave may have infected one or two other people, this one may affect as many as 3 or 4 and even more than that.
Looking at why this thing is spreading so fast, what are some of the reasons that have been studied as to why this spread seems to be going at a much faster pace than what we've seen?
So one of the issues is it being more virulent and just easier to spread. The other is folks not getting vaccinated. So vaccination can help protect us from some of the severe complications of COVID, and that's really the best defense we've got.
Looking at vaccine hesitancy, we've discussed it before. There have been multiple stories on this, and it's covered quite a bit. But based on what you've heard in the office or from patients, what are some of the reasons you've heard, and how have you and the rest of the medical community tried to ease some of those fears and that hesitancy here in the state?
Chris, it spans from any and everything to folks being afraid of needles. Folks that have in their life never really taken vaccines prior to now, so it's really a big step for them. Trust or distrust of certain systems, whether it's medical or the government. So there are all types of personal reasons. Some folks have had really close friends who had some of those rare but serious and really frightening complications from other vaccines. Some folks have allergies to other vaccines. But Chris, this is the time, if people are on the fence, and I haven't done this before, I'm asking people to please get vaccinated. If you're on the fence or, you've been thinking about it, go ahead and do it. We haven't even hit winter. We haven't even begun to see the other respiratory viruses such as RSV and flu in addition to COVID. It's going to get really bad, Chris, and getting vaccinated is the best defense we've had. So for folks who've been thinking about it and just holding back, go ahead and do it. For other folks who, have personal health concerns, that's the other reason. People have legitimate health concerns, breathing issues, and they're really worried about having a reaction to the vaccine. Talk to your pharmacist, talk to your doctor. Please just let us help you because we're all in this together.
Well, thank you again, Dr. Stokes, for taking time out of your morning to talk about this. And we appreciate all the work that you and your colleagues do at Baptist Health. If you'd like to contact Baptist Health, you can do so anytime at the information on your screen. Dr. Stokes, we'll see you again next time.